Hello, everyone. Now, this is Jeremy, who has suffered with chronic pain for many years. And I think with his story, we can actually learn a lot about someone's journey. So, to start off with, I think it's best for you to tell us your story there.
Yeah, well, this started, I guess. Well, I don't guess. I had to look up this because it has been quite a journey, and maybe not as long as others. But 4 years ago now, I had a pretty severe accident on a motorbike. I was in Thailand, and I had an open bone fracture and a lot of soft tissue trauma around my heel. So I actually ended up losing about 50% of my calcaneum in the initial accident, and a lot of people think Thailand's such a bad place for it to happen. I was actually looked after very well there. I had good insurance and went to a very good hospital, and they put me back together quite well. They were able to put my Achilles back on my existing heel bone, put it, sew it up best as possible. But it was quite a mess, and I spent 1 week there in the hospital with really great care, but the insurance company that I was with, they wanted to get me back home as soon as they could. So in saying that, while I was there, the private hospitals knew that I was just there for a short time, and they obviously have regulations and guidelines and all the rest, but I was getting quite high level opiate pain relief. So I believe it was morphine. I can't remember. I think it was about 4 hourly, and it was enough it would make my eyes roll back, and it felt incredible, and I wasn't in pain. So they did a good job of keeping me out of pain and on antibiotics, all the rest of it to get me through that week. But what I found is when I came back to Australia, and at this time I didn't have private health insurance, but I basically, the travel insurance company got me back to Australia. Then it was up to me. And I fell through a lot of cracks for a good 12 months. I think if it had happened here, that may have been a different scenario. But I fell through a lot of cracks, and I didn't quite get the treatment that I needed. And I ended up 12 months on still with some of the tissue had died away. I had an open wound. I could basically see my bone through the hole in my foot. So it had developed osteomyelitis, the bone infection. It just wasn't healing until one particular surgeon decided to sort of say, hang on, we need to do something here and get it done. But unfortunately, having that on my foot for a whole year and taking opiates that the whole time, my tolerance grew incredibly. And my only understanding about pain was that, if you're in a lot of pain, you get strong painkillers. You don't get told anything about them. So my tolerance was so high that when I went in for the final surgery 12 months later, I thought I better tell them how much I'm taking. And the surgeon, I think anaesthetist, said to me, we can't safely give you a general anaesthetic because the dosage of endone or oxycodone at the time was so high that they said, we're not going to be able to keep you asleep. So I had to have a spinal during that time, which is fine. But that's when I really realised that it was serious where I was at 12 months later. And for that 12 months, most of it, I was running around, had a boot on and, because I'm on these painkillers, you don't feel anything. And I'm running around doing everything I need to do, but it was just a complete Band-Aid on that, It wasn't fixing the source of things. So anyway, it did that. And what I found after that was that I left hospital that time, still not being explained anything, nothing being explained to me, but said, your dosage is too high. And I got sent home with 2 methadone tablets. That was it from the hospital. And they said, you need to go see your GP to, sort this out. Go see my GP. My GP said, and he's fantastic. He's been along my side through all of this and done his best from his knowledge. He couldn't prescribe methadone because under the license or whatever the particular framework is around that. He couldn't do it. So then I'm left going back to oxycodone again. and he's trying his best not to give me too much. And this is going through a time where they were getting a bit strict on it. And and I'm not proud of it, but this is what that drug did to me, is that I was doctor shopping and prescription shopping, different pharmacies, different doctors, just so I could keep the dose that I had, because not one doctor would give that to you. And I think that's a pretty common story with it. And I went through that for quite a while. My GP was very good, and he referred me to a pain specialist, and he was a great stepping stone as well. He did care about the patient, but he only had a certain amount of tools within his, box that he could use. And we tried, the slow release tablets, I think Palexia and those, the tramadol sort of family, which didn't agree with me very well at all. And he did mention, I think we need to get you, like the psychiatry side and the psychology side, but never really much direction. And yeah, so I tried all sorts of different new pain reliefs through him. I mean, there was Temgesic as well, and all these different ones. But because of the amount of opiates I'd been taking, none of this was as effective. And I ended up with him. We were trying ketamine as well as another pain relief, resetting the pain sensitivity, all this kind of stuff, new studies, and none of it really worked for me. And I think around about this point is when I had a friend recommend you from his injury quite a while ago, and just said, "Oh, just give it a shot," And I think that's when I came to you, because I am sort of going over quite fast about those different things, because there's a bit more to it. But I think you and I spoke about this, is I was ready because I was over it. I was like, hang on, I'm not going to be able to get enough of this opiate that I need. And I tell you, it is effective. It's an incredible drug, but I've come to believe now, and this is something we'll probably cover later, is that it's so short term. It's for a quick whack. You need, some serious pain relief, and that's it. And you leave it there. It can't be used. Well, that's my belief for any, I think a 5-day period and you're pushing the boundaries. That's what I find for myself. So that's when I came to you, and I thought I'd just give it a shot, because I've tried so many different therapies, acupuncture, physio, trying to cover it all. And also going through that period where we were on ketamine and everybody's trying to cut me off opiates. One thing I noticed is that there was no support that I could come across, or anybody trained to get you off opiates, unless you're going into a rehab, which I think is a bit scary for a lot of people to go, oh, do I need rehab? I think there can be something in between that, because you can't just stop taking that medication. It's so strong, I think. And so that was sort of, it was a good 12-month period to get my injury somewhat stabilized, and then there was the recovery from there, like rehab and things, and just walking and trying to get it happening again. But that's when I was still completely, dependent on opiates.
So at that point, how much was pain affecting your life and really controlling what you were doing?
So at that point, this is in hindsight, not at all, because I was taking opiates.
If you weren't on the opioids, what would happen? The sensitivity with your heel, what you were doing in life?
Well, in that period, because it wasn't stabilized, the injury wasn't stabilized, I think I wouldn't have been able to do anything. Yeah, I wouldn't have been able to move around, get up in the morning. It would have just, it would have been that. That's back then, though. It's different if you ask me today if I had that same pain. So this is back then, putting myself in my shoes, because then I had no relationship with pain, or no understanding of pain, I guess.
So at that point, your knowledge of pain would have been, I'm in pain, I'm damaged, and then you've got to try and
Correct.
get rid of the pain.
Correct.
And I suppose that was one of the biggest things you took from our consultation was
That's
actually
right.
this idea of living well with chronic pain.
Mm.
And when I first mentioned that to you, you looked at me very strangely because it was an extremely foreign concept for you.
Mm-hmm. And
But
I think it is for most people because with modern medicine, why should we have to deal with pain? And I think that's a really false economy. And I think you sealed that for me. You got that in the therapy. We are not going to live pain-free. And I think that that's a really big thing. And I can only talk from my injuries. And I know my one sounds serious, but at the same time as I still get flare-ups of back pain or this and that. And I go, God, I couldn't deal with this every day. But I think when you do deal with it every day, you can have a relationship with it. I'm not saying it's pleasant. I'm not saying it's fun, but you can live with it. And I think that that's the thing is something that I took away from our meeting or, our sessions is that we do look for diagnosis or an answer to pain because we believe when you have pain, there's something wrong. But I mean, for instance, now my foot kills me some days, but I know that it's okay. So I tell myself it's okay. Yeah, okay, pain can be there. And I think that that's a big part of it, and it takes practice, but that's something that was different with you was, a non-medicinal approach. There was never any talk about taking medicines. It was a psychological, almost like a practice or a meditation or something,
Yeah, so what we were doing there was actually creating a relationship change to the pain. That pain was allowed to be there, and I was still allowed to live life as well. And I suppose that took a few weeks for it to slowly get cultivated in. But then there was a point where you said, pain is not really controlling my life anymore. It's like when it comes on, it's there, you acknowledge it. Then you'd go on with what you were doing again. And I think that in itself was a really powerful moment that the pain could be there, but you could still live life as well.
That's right. And it's interesting because I suffered a lot of anxiety when I was younger. And actually, looking back on it, a lot of it comes from prescription drugs, I believe, exacerbating. But now, and there's a correlation between anxiety and pain, not just if you have anxiety, it makes pain worse. But what I'm saying is I adapt the same concept with pain and anxiety because we're humans. We're going to have anxiety and we're going to have pain. And I have a relationship with them. And they're separate, completely separate in their own entities. Everybody's going to do it in a different way. But I actually have a little bit of an argument with them. And I tell them that I'm not going to have you. I'm not going to have you. I'm not going to allow you any more space than what you're already taking. And that's it. And I leave it there and then I just continue doing what I'm doing. And it almost puts it just somewhere else. And it's only by experience. I can't explain exactly how that works, but it is.
And a mindfulness practice, a lot of the times, what we're doing there is creating space. So by giving it, we'll use the word acceptance, but let's say a willingness to let the pain be. And the pain's there, but I'm going to give it space to be there. But I'm also going to give myself space to do all those other things which are more important to me. So you're making a bit of a choice there as well.
Yeah, I think what I find with it, just personally, is that acceptance is a great word. I think we have to accept things, especially if you can't, really change it. You need to accept, and that gives you a lot of peace. My thing, and again, only personally, is I don't give it space. Because I believe if I give it, I think there's that saying about which wolf survives. It's the one you feed or whatever. Oh, sorry, 1 second.
That's right.
Just cut out for a second. Whichever one you feed is the one that survives. And so I just don't give it anything. I don't give my anxiety anything, and I don't give I accept they're there, but I will not feed them in any way. If I say to myself, sorry.
which I think is a really good way to put it there, because you are giving them a bit of space at the side, but you're not feeding them. You're not
No.
actually developing the story around it or getting into it. And I think
No.
that was really, really powerful there. Is the second way you sort of said that was, I'm not going to feed it anymore. It's there.
It's
But
there.
I'm
Except
going to
that.
feed things which are more important to me.
Correct. Yeah.
And I suppose me now, watching you now, I can see that you've come a long way, because I haven't talked to you in the past 2 years. So for
Yep.
me, I'm just as fascinated to find out how you've gone over this to a 2 year period as well.
Yeah. So, gosh, I can't believe it's been that long since we saw each other. And I guess COVID kind of did shut down the able to have regular face-to-face appointments. I think we did a few video calls. But I think I'd gotten so much out of a short time with you. I don't think we even saw each other that long, but I was ready to hear what you had to say. And I can definitely say that what you've come up or what you've learned from it and what you're able to articulate to others, it does work if someone's ready to hear it. And I guess I got enough out of that short time. So from the period then till now, look, I function every day quite well. I suffer pain. I shouldn't say suffer. I have pain. Definitely in the foot sometimes, but then, you know what, sometimes it's not there. And that indicates to me that it's not a big deal. Well, if it's really that bad, it'd be there all the time, you know. So I get breaks from it, but when I get it, it's acute and it hurts. And then I've got the roll on, you know, being, you know, you remember my back's out of whack and everything's out of whack and whatever. And so I get flare-ups in my back and things like that. But you know what, I function very well. Because I don't talk about pain anymore. I don't talk about it because that's feeding it for me. And if as soon as I sometimes I go, oh God, that hurts, you know, or whatever, and that's fine because you acknowledge it's there, you accept it's there, and then that's it. I'm not going to feed into this. I could sit there and go, oh, I'm not going to walk anymore. I'm not going to, you know, but I accept that we're always going to be in pain in one way or another, physically, emotionally, you know. So since then, you know, I've continued working, still in a similar line of work. I have, interestingly enough, and this is something that I think is that I think you'd like to have some insight on. Now, we went over about, and I think a big part of your approach, when you explain pain, I think I still got it in my head about that box inside the brain that has the strongest painkillers in the world. You know, I think that was the word, that they're far stronger than anything else we can put in our mouth or whatever. It is incredible. And I think I can really relate to that in the sense, you know, when the accident happened, you know, my foot was basically hanging off. Wasn't that bad. Didn't hurt that much. But you go on after that period, you know, and okay, the body figures out, okay, and people call it shock, whatever they want to call it. But obviously it did develop some kind of pain relief. Then I believe having, you know, any kind of narcotic or whatever, it takes away the effort the brain has. The brain doesn't have to make an effort to kill pain. And I think we know some similar things like this that, and I'm getting on to the reason why, but if you know, it's another muscle, the brain. If it doesn't get exercised, then it's going to stop doing what it needs to do. Now, being off opiates for now, well, when I saw you, I think I just tapering off. I really had to push myself to get down off, you know, from, you know, the oxy to codeine and so on. So it's about 2 years now. I have had a handful of times I've had a hospital visit with a truck accident and stuff where I've had morphine or I've had endo. Now, what I found is they weren't as effective as what they used to be, but what I found was when I just had it while I was at hospital or had it once off, the days after, my pain was far worse, which is an interesting thing. Even in such a short period of time, I could take small amounts of these opiates and then it was the days after that, and it was my foot, because I know my foot, not the other pain I had. My foot was worse than what it was before. So I just don't go near it, because I know if I take it, it might give me some remedy for very short term, but afterwards it's far worse, and it's a time and a place for it. And I think it's overused still.
Excellent. So it sounds like the past few years, you've actually learnt a lot. Now,
Heaps.
What activities are you engaging in now? What things are you really enjoying?
Okay, so that's interesting, because we also covered that, and in our therapy, something interesting, exercise, right? Now, I'm not a big go out and just focus on exercise and an activity, because I'm a little bit in the way that I will, it just should be part of our life in saying that. But I just go on and try and incorporate it in whatever I can. Now, haven't been exercising so much lately, and I suffer more pain. And I'm not saying going out, it's just walking. This is something you and I went through that, and you set me really achievable targets in the beginning, which was so helpful, because there was no pressure. I think pressure is not good in these sort of situations. And I think you said to me, it was maybe, I think you said 500 meters. Go for a 500-meter walk. It doesn't have to be fast or anything. And you know what? It hurts like hell at the time, but afterwards my body feels better. The whole lot of it. My back is better, because it's all this movement. If you're not moving, pain's so much worse. And so at the moment, my activity is not as high as it could be. I work a bit more than I'd like to at the moment. And so my pain is worse, but I can understand that, because that makes sense. So I'm not looking for, what's the problem? Why do I hurt more? Okay, if I went out and I was moving about more, it would be less. And that was a key thing. Movement is big, and it doesn't even have to be hard exercise, just movement. Because we don't do enough of that now. The way that most people are living now is just not really conducive with being particularly pain-free or healthy, and I think that's why the modern medicine went to the answer of a tablet rather than just living the way we're meant to. So, so I guess, a physical activity, not a lot at the moment, and I do get more pain. That if I was to do more, I would have less.
Yeah, so it sounds like over this time, you've certainly come a long way, and you're looking really, really good now. I think when I first saw you, you were certainly stressed out with the pain. It was always on your mind. It was controlling your world a lot, where now I can see that pain can be there, and you're still going on and doing the other things that you need to do. And that's brilliant. That's really cool.
Yeah, absolutely.
So you're a really great example of someone who's living well with chronic pain. And there are periods where the pain will go away for a bit, which is fantastic. But on the whole, you're still out there doing everything you need to do. To show you how bad the sensitivity was when Jeremy first saw me, even putting on a work boot, just touching lightly on the back of the heel was excruciating. And within a few weeks, he was able to put his boots on again and been able to work as a truck driver, which was really cool, because there was points there where you're thinking, how am I going to work in the future? What am I going to do next? So there was all these really powerful beliefs and thoughts there. And the good news is, all these years later, you're still doing the job that you really like, and you're also doing really well.
Yeah. And just on that note quickly, I can still have massive sensitivity, but it's short-lived, generally. It might be one day I have to deal with it, or one afternoon. But I just know that I can deal with it myself. I don't have to jump out of the fry pan and, oh my gosh, I've got to stop this pain right now. It's okay. It's there. It's uncomfortable. I don't like it. But I believe, but it's practice. You do have to practice. I think that's a big part of it. But having the guidance too, from someone, like you were the icing on the cake for me. It put it in a manageable basket, and I was able to process it and use those tools, along with other tools that I've learned over periods. But a non-medicinal approach, I think, is really important.
Excellent. And at the time when you first saw me, you actually had your pain specialist who was looking after the drug side of it. You had your doctor. You had many different people.
Yes.
but no one was really working together. So I think
No,
actually bringing that together in some sort of coherent unit was definitely a massive key.
I think communication between them all would have been fantastic, because there was times that I did feel not even like a patient, but like a drug addict. And that's hard, because yes, I was, but it was a product of a particular circumstance or a particular accident, whatever, And I think, yeah, my GP was very good not to do that, but I had other times, especially in hospitals and that, like, whereas if everybody, had come together and if you could speak to my pain specialist and my GP and my physio, because I can turn up to a doctor and say, oh, look, I've got a lot of pain. And they go, well, look, you're already taking all these opiates. And it's like, yeah, but I'm also seeing a physio. I'm seeing a myotherapist. I'm seeing a, pain specialist. You won't get treated quite the same because there's a stigma around it.
Yeah, well, thank you for sharing your journey today, and I'm sure it will help a lot of people. Because there are many people that are stuck on that roller coaster where they're lost and they don't know where to go next. And at least this little interview just gives a glimpse that things can change,
Yeah.
and that you can get a lot better. And we don't have to get rid of pain to do that.
No.
There's many other things we can do to live well.
Correct. Yep. Absolutely. And I thank you for everything you've done, Matt.
No worries at all. I'll just stop the recording and we'll have another chat in a few seconds.
No worries.
Just find where it is. Oh, there it is.